So the pectoralis major muscle, a broad muscle, fan-shaped triangular muscle covering the anterior chest wall. This muscle overlying several structures like the bones, the muscles, the nerves, arteries, cartilages, and the veins. So muscles, arteries, bones or their parts, veins and nerves. The broad muscle, the pectoralis major muscle, running from the lateral part of the sternum, medial part of clavicle, and the aponeurosis of the external oblique muscle, running laterally to be inserted on the lateral lip of the bicipital groove or the intertubercular sulcus. It encircles the muscles, arteries, bones, veins and nerves of the region. So again I will draw the pectoralis major muscle here. It is having clavicular fibers, the sternocostal fibers, and the fibers from the external oblique muscle. All fibers are converging laterally to be inserted on the lateral lip of the bicipital groove. Clavicle is here. This is clavicular notch. Deep sternum, so structures under cover of the pectoralis major are the bones, sternum, the anterolateral part of the sternum, the part of the clavicle, the coracoid process of the scapula, fingertip shaped coracoid process can be seen here. It is also covering the coracoid process which can be felt in the deltopectoral groove. It is also enclosing the ribs and the cartilage of the ribs, the costal cartilages. So these are the structures or the bones: the coracoid process, the clavicle, the manubrium, and the anterolateral part of the sternum, the upper ribs, and their costal cartilage. When we talk about the arteries, the axillary artery, Simply, the artery is the continuation of the subclavian artery between the scalene anterior and the scalene medius muscle. The artery is subclavian artery. Then artery is running as the axillary artery. And branches of the axillary artery. The artery is divided in three parts. The first part, then the second part, which is deeper to pectoralis minor muscle, and the third part, which is lateral and inferior to pectoralis minor muscle. First part is having one branch. Second part is having two branches. The big thoracoacromial trunk or branch, are also known as acromothoracic. Then the lateral thoracic, which is running on the inferior border of the pectoralis minor muscle. And third part is having three branches, the anterior and posterior circumflex humeral arteries and subclavian arteries. All are lying deep to pectoralis major muscle. The veins, again the axillary vein, which is lateral to, which is medial to, artery is lateral and the vein is medial, and here it is coming from the medial part of the scalene anterior muscle. This is the boundary formed by scalene anterior muscle. So vein is medial and artery is lateral to scalene anterior. When the vein moves medially and upward, the name of the vein from the outer border of the first rib is changed from axillary vein to the subclavian vein, which will form the superior vena cava with the internal jugular veins. So these are veins, and all tributaries which are draining in the axillary vein, like the cephalic vein, the brachiocephalic vein, directly or indirectly, the lateral thoracic, subclavian, and all accompanying veins of the branches of the axillary artery. The nerves, a tangle of nerves, a grid of nerves, net of nerves known as brachial plexus. The cords of brachial plexus are the posterior cord, the lateral cord, and the medial cord. And the names of cords are according to the relation of the cords with the second part of the axillary artery. So behind the pectoralis minor muscle, there is second part of the axillary artery. Cord which is posterior is the posterior cord. Cord which is medial is the medial cord, and cord which is lateral is the lateral cord. And the branches of these three cords are lateral, medial, and posterior in the third part of the axillary artery, or the inferior border or the lateral border of the pectoralis minor muscle. So brachial plexus, cords, and branches. One more nerve, the intercosto-brachial nerve, can also be seen in the deep relation of the pectoralis minor. Three muscles: the subclavius, the pectoralis minor,